Hi, my name is Bruno Chen. I'm a third-year medical student. I'm here today to take a look at your tummy, but I will also be looking at your face, your neck, and your hands. Would that be okay with you?
Yep.
And I'll just check first. May I know your name?
Cedric Chua,
Okay, and your date of birth?
12 May 1994.
So how old does that make you?
23.
Would it be okay if I call you Cedric?
Yeah.
I would also ask to take off your shirt so that I can have a better look at your chest and your abdomen. Would that be okay?
Yeah.
Okay, thank you. I will help you. Okay. On a general inspection, the patient seems to be comfortable, not in any distress. There's no cachexia, there's no jaundice or other skin pigmentations, and the patient seems to have a healthy nutritional and hydration status. In the surroundings, there's no IV lines, O2 drips, stoma bags, and no NG tubes. Now, would you mind doing this for me, please? Thank you. Okay, so there's no finger clubbing. There's no leukonychia, no koilonychia, and no tar staining. Okay, now would you mind doing this for me and closing your eyes? Ideally, I will wait for 30 seconds, but due to time constraint, I will just observe for 5 seconds. And there is no asterisk. That's fine. Thank you. Now, would you mind if I flip your hands over? There's no pulmonary edema, and there is no pallor in the crease. There's no dupuytren's contracture. Okay, that's fine. You can relax your arms now. I'm going to take your pulse. Okay. Okay, the pulse is 60 beats per minute with a regular rhythm. I will also offer to do the respiratory rate and the blood pressure. Now, would you mind putting your hands on your hips, please? Okay, thank you. Now, looking at the arms, there's no bruising, scratch marks, needle marks, acanthosis nigricans, there's no muscle wasting, and no petechiae. Okay, relax your arms now. I'm going to take a look at your face, okay? Would you mind pulling your eyelids down for me, please? Thank you. There's no conjunctiva pallor, no jaundice, and no kinds of flashing rings. Thank you. That's fine. Can relax now. There's also no hydration sunken eyes and no xanthelasma. Okay, I'm going to move on to the mouth now. Would you mind breathing out through your mouth for me, please? Okay, there's no fetal hepaticus. There's no angular stomatitis and no telangiectasis. Would you mind opening your mouth for me, please? There's healthy mucose and healthy dentition. There's no signs of leukoplakia or erythroplakia. Would you mind lifting up your tongue for me, please? Okay, there's no central cyanosis. And now would you mind sticking out your tongue for me? Okay, there's also no glossitis or thrush. That's fine, you can relax. Thank you. Moving on to the chest, there's no gynecomastia or there's no spinal nevi. Would you mind putting your legs to the side for me, please? Okay. I'm going to feel for your neck now, okay?
Yeah.
So, submental, submandibular, preauricular, postauricular, occipital, anterior triangle, posterior triangle. Would you mind shrugging your shoulders up for me, please? Thank you. And supraclavicular. Yeah, that's how you can relax now. There's no enlarged lymph nodes. Okay, I would like to ask you to lie down flat now. Would you like 1 pillow, 2 pillows?
Oh, one is fine.
I see you now. Okay, would you mind breathing in and out for me, please? Okay, that's fine. So the abdomen rises and falls with respiration. There's no visible masses or pulsations. There's no abdominal distension. There's no central bruising, and there is no flank bruising. There's no Sister Mary Joseph nodes. There's no scratch marks, no scars, no striae, and there's no caput medusa. I'm going to feel for your tummy now. Is it painful anywhere?
No.
Okay, do let me know if this is painful, okay?
Okay.
So we start with the right hypochondrium, epigastrium, left hypochondrium, left flank, umbilical region, right flank, right iliac fossa, hypogastrium, left iliac fossa. Was it painful anywhere?
No.
Okay, now I'm going to press a little bit harder, okay? Is it painful anywhere?
No.
Okay. Now I'm gonna continue feeling for your tummy, and I'm gonna ask you to breathe in and out. Is that okay?
Yep.
Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Okay. So the lower board of the lever was not felt. I'm going to tap on your chest now. Okay. So there's a normal lever span. Now I'm going to feel for your tummy again. I'm going to ask you to breathe in and out, okay? Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Okay, so the spleen could not be felt. I'm going to feel for your kidney now.
Okay.
Okay, feel on this side. Okay, gonna feel the kidney on both sides. I'm going to tap on your tummy now, okay?
Okay.
Okay, it was resonant on percussion, but if it was dull, I would perform the shifting dullness test and the fluid trail test. So for the shifting dullness, I would ask Cedric to lean towards me, and ideally I would wait for 30 seconds to 1 minute for all the fluid to go down, and when I tap again, it would be resonant. You can lie back down. And also for the fluid trail test, would you mind putting your hand like this for me? Okay, so I would lightly feel on this side, and as I flick on this side, I would be feeling waves on the other side, and vice versa. Okay, you can relax now. I'm going to listen to your tummy now, okay?
Okay.
Okay. So there are normal bowel sounds. There are no renal artery bruits. There's no abdominal aorta bruits. Okay. I'm going to feel for your legs now, okay?
Okay.
Okay, there's no peripheral edema. Now, I'm going to touch your legs. Does it feel the same on both sides?
Yeah.
Okay, there's no sensory neuropathy. So to conclude, I will perform an examination for inguinal hernias, a digital rectal exam, and an examination of the external genitalia. Okay, I've concluded the examination now. You can put back your shirt on. I will adjust a bit. Okay, so I'm going to report back to the consultant now. Thank you so much for your time.
Thank you.
I've just conducted a full GI examination on Cedric Shah. He's a 23-year-old male patient that presented with no peripheral signs of GI diseases. On inspection, he was not jaundiced, he didn't have scars, there was no abdominal distension, and there was no visible pulsations or peristalsis. On superficial and deep palpation, there was no tenderness or masses felt in any of the abdominal regions. On percussion, his abdomen had a resonant note. On auscultation, there was no renal artery bruits, there were no abdominal aorta bruits, and there were normal bowel sounds. To follow up, I would suggest an abdominal X-ray, liver function test, and full blood count. Thank you.